past and I'm reliving the past in my mind.
So the mind has the capacity to make the past actually real at the moment.
Yeah, no, it just makes it reality right there and then. So even when you do a to-do list, the stuff that you didn't finish yesterday, you bring it into today. You bring in the negativity of the mindset, the reason why you procrastinated with that item that it didn't finish. So all you're doing is you're bringing the past into the present. So you've got to rethink, consciously rethink around it. So the education needs to be around, okay, let's educate our patients now that when you're preparing for the next visit, there's a few things you need to be paying attention to.
And before we get on to that, it's also in terms of preparing ourselves, in terms of health practitioners, in terms of we're not just treating the teeth, we're not just treating the appendix, we're not just treating your hand. It is part of a person. And you cannot separate one part of a person from the rest of that person.
Yeah.
We are about looking after people.
Yeah. So if I had to coach a dentist on the neurology of a visit, I would say that from the moment they move into reception, the hearing needs to switch on. So there's got to be relaxing music there. Your receptionist needs to be engaging. They mustn't sit down and look at a book. They must get up. They must greet the person, because touch is critical at that time. So there's moments of touch that needs to happen. When you greet the patient as they're coming in, hand on their shoulder appropriately, welcoming them, eye contact is critical, and welcoming in your tonality of voice, because that's also where they pick it up. And the mental preparation of a dentist specialist who's going to work with the patient is, I look at the file, I look at the x-rays, I know what I'm going to do technically. But if I don't touch a patient on the shoulder or greet them by the hand and say, good morning, how are you? And keep them standing and going, so I'd like you to relax and just breathe with me. Let's just breathe together. And let's have 3 lacquer deep breaths. And so here you are. So using that statement, so here you are, brings the mind into the present. So here I am. My goodness, here I am. Here's the chair. Here's all the...
Does that help to
calm them?
Calm them.
Yeah.
And to push the negative memories and
the amygdala is switching on.
All
inhibitor neurotransmitters are switching on, and they're going, run away.
And so this helps
it just helps you. And the breathing is the critical part of that.
Yes.
And so you also need to initiate breathing while you're doing whatever you're doing with the patient in their mouth. Music needs to come in. You can have a little fountain of water bubbling in the backdrop with a little plant somewhere. So it just goes, I'm not coming into this clinical, and I don't know whether a plant and flowing water will be allowed in this clinical space, but music definitely.
Yes.
My mentor, who is a neuroimmunologist, a Jewish neurosurgeon, he does some operations on the brain where they're literally brain dead. They're only living on machines. So they're dead. They're scientifically dead. It's just machines that keep it. And then they operate. And he's had cases where patients, when he comes to visit them after the operation, go, I don't like Western music. And he plays Western music.
So and
under anesthetic. So the question is, what's bigger than the brain?
Yes.
Is your consciousness.
Yes.
And your consciousness is not just contained in the space of your brain. My magnetic resonance is happening 4 meters around me. Your magnetic resonance, that's why we click, is because of the electromagnetic resonance that's happening. And that has been measured by Harvard. where they've taken a person,
that is a very
watched a
important
horror
factor that
movie,
we
they've
can
taken
just
red blood
address
cells,
for a moment.
and they go 11 kilometers down the road, and they watch the horror movie and what it's doing to the molecules and the cells 11 kilometers away.
So they took blood from the patient or from the test subject, took the blood 11 kilometers away, and the blood cells were reacting
to the movie that they're watching in this room
11 kilometers away.
Yeah.
Well, that's
so we are far more interconnected than we actually know or believe, you know. So now coming back to the experience is allowing the patient, when their head is back, to relax, the mouth massaging around here every now and again, and the dentist must do that. The dentist must go, just allow me just to massage here, put the fingertips there in the joints and just relax there. So just move your jaw up and down a little bit, slightly breathe in and out. Are you okay? The language of meaning and the vestibular language has got a few purposes within it. The vestibular is direction, movement, pacing, timing. So in the backdrop of the neurology, the questions is being asked by the neurology. How long? Yes. How far are we with this? So the dentist needs to update the person every now and again, going, give me another 2 or 3 minutes. I just need to do this. This is part of the procedure. I'm now going to do this with you. That's going to take so much. You're going to feel cold air at the moment. Relax it. Breathe in. Get ready for it. Remind yourself that it's going to do whatever it needs to do. We need to dry the tooth on the inside before we put whatever in it. And so you explain what needs to be done. A friend of mine had to go for his third heart surgery, and he was one of my mentors in neuroscience. And he said, you've got to talk to me because I'm already triggering and I'm scared and whatever. So I counseled him and worked with him and found that he was very visual, but he was also kinesthetic, and he needed cognitive input. So I said, what you need to do is take a piece of paper, draw a body, put that in front of the doctor and tell the doctor, here's a pen, take me through the procedure. And I want you to tell me from step 1 what you're going to do. The doctor refused. He said, if you don't do it, I'm not going to have the operation. And the doctor said, fine. So he drew and he said, we can first of all put you to sleep. We're going to tell you to count to 10, but you won't get to 3. We know that. Yes. And you'll be in la la land. And then from that point on, the team moves in. What you didn't see over there was a stainless steel saw that we're then going to open up your sternum, and we're going to cut it open. Then we're going to put a clamp in. We're going to open it up about 11 centimeters or 12. We'll possibly...
My triggers are starting to be highly activated just by the discussion that's taking place.
And the guy says, do you want me to go on? He said, I want you to go on. And he says, then we open up so we can get to your heart. We'll possibly have 4 cracks as 4 ribs break at that moment. And then we're going to cut, and he says, I'm going to get to your heart. I'm going to put my hand under your heart, tilt it. We're going to clamp 2 arteries, and then I'm going, and Armand said, stop. And then Armand made a fist, and he reached across to the doctor, and he said, I want you to hold my fist like you're holding my heart. So I want you to hold my fist. Do that. I want you to, as a doctor would hold it, as you're going to hold it in the theater. And he closed his eyes and he said, I want you to relax and hold my heart exactly like you're going to hold it in that moment. And Armand, with his eyes closed, burst into tears. The doctor cried and he said, what's going on? What's going on? And he said, doctor, if that's how you hold my heart when I'm unconscious, you can do the operation. Don't need to go any further. And so when I coach executives, my question always is, how the hell do you hold the heart of your customer? And that's a moment of where I put my full trust in. In fact, I'm on the table and I'm not there. I'm really not there. I'm in a conscious level out of my body. So it's in like a pre-state of death. That's why people can come out of that operation that my mentor does and say to him, I hated your Western music, and I also didn't appreciate the way that you spoke to the sister and shouted at her because she gave you the wrong instrument. Where was the person? Another person told him, my mom and dad were in the chapel and I heard them praying. And I went to them and stood next to them in the chapel going, it's okay. I put my hand on their shoulders and said, I'm fine. I'm in good hands. So our living consciousness lives on. I mean, we're far more, we don't even know everything that's happening in we're not just confined in our biology. Our consciousness is not just confined within the brain and 4 meters beyond us.
Well, I'm
Sure.
completely, yeah, I mean, I almost burst into tears. We so understand that we're dealing daily with people, with people's lives, with their brains, with their hearts, with their teeth, but with the very essence of who they are.
Yeah.
And it's a very real situation. And the way that you unpacked it and explained it based on how your friend actually went through it is just phenomenal.
Yeah.
And I would really urge every medical practitioner and dental practitioner, every physiotherapist, in fact, any health professional.
Yeah, we need to have a course.
to actually just listen to what you've said, because it is just profound.
Yeah. So a dentist can, just like any other medical practitioner, I mean, I'm going into minimal surgery on Monday, and it's a daycare, so I'm in and out, and it's a minor thing, but to me it's a major thing, and so I'm going to have to tell the anaesthetist, you need to give that oxygen mask to me now, and I'm going to put it over my nose and mouth, because the last time I was in the theater and they pumped that thing on me, I went mad. I just had a claustrophobic moment that I grabbed hold of the sister and I said, take it off me. I'm going to break your hand. Take it off me.
And this is what's so critical, Bill, when people interact, when a patient and a professional interact, there are emotions on both sides, because the last thing that we want is a patient that is not comfortable. We want our patients to be safe. We want them to be comfortable. We want to be able to get them into a situation where their health is improved.
Yeah.
And so unbeknowingly, the anaesthetist actually, which would have been standard operating procedure, or the anesthetic sister would have placed the mask over your mouth and nose. But for you, that was an absolute trigger. And the fear that it aroused in you would have had an equal and opposite effect in them as well. They must have been completely traumatized and devastated.
Yeah, I mean, it got to the point where the anaesthetist said your heart rate and whatever we can't do. It was going to be a minor operation on a skin graft in my ear.
Yeah.
And the doctor had already told me that he's going to do it. He can do it locally, but I must come in for theatre for some reason. And I've been at an operation before and didn't have that effect. But what triggered me that day, I don't know what it was. It was just some memory way back that decided I'm now coming to the party.
So this wasn't even a memory of a similar circumstance, because you never had that.
That
before.
memory, when I did reflection, that memory was when I was in the fire brigade, and we did diving.
Yes.
Scuba diving.
Yes.
And they closed off the tank as part of the exercise. And I went, and I walked on the water in the next moment. I climbed out of that water, and it was, so I've always got I joke with God and I go, please, when I die, I want to go.
And you want to exhale.
I want to exhale when I die. If you want me stressed in heaven, go. That I don't want to die like that.
I so understand what you're saying. We were busy with our search and rescue certification, and part of it was actually unbeknowingly at some stage having your air closed off. And it is just you.
Not a good moment.
Yeah, breathing becomes so labored, and then
there's nothing.
And then there's nothing. And you suck. And you suck. And there's absolutely no air coming out at all.
Yeah.
And it is a very scary moment. So one has to be well prepared. And again, preparation in terms of the coaching, the training, which is how you have not only helped us today and all of the health professionals who are watching and who are going to watch, but how you would coach people to overcome their fear of dental or medical visits.
So coming in, I would offer maybe a lemon tea, just a half little cup of lemon tea. Drink that.
Why is there lemon tea, if I may ask?
Lemon, you want to counteract the acidity in the mouth. So lemon actually counteracts the acidity if you drink it fast.
Yes.
And then it goes through. And the warmth just makes that warm, fuzzy feeling.
Yeah.
You get the person to sit down. You're going, so tell me if you could tell me in 3 short things, what are 3 things that you're thinking right now? I'd love to hear what you're thinking. And you sit facing the patient. And the person will say, well, I'm thinking I'm going to have a tooth drilled and I'm a bit worried and nervous about that, and going, okay, so on a level of 1 to 5, how worried are you? Going, okay, great. So, could I invite you just to close your eyes and find your happy place and go there and just breathe in and out? And
that's breathing in and out 3 times.
Yeah,
is that
3
correct?
times.
It's
Good,
3 times.
A good in and out. They must feel the air going through their nose, coming out of their mouth. And then they relax and they go, stay there. In actual fact, I want to invite you to go there whenever you are sensing tension. Just go breathing and relaxing, breathing and relaxing. Another thing you can do is if you tense and you do crunch your toes, crunch them then really hard, intentionally. Breathe in and breathe out and release your toes.
Yes.
So that there's the biology must feel the release of energy. And the clocking in every now and again, going, I'm busy with this and I'm busy with that. While I'm doing that, just take a breath. Would you like to rinse your mouth out? Or if it's possible, etc. That needs to be done. So maybe a little bit of warm water in the rinsing would add a little bit of value, just so that there's a difference in the cool temperature in the room and the warmth in the mouth.
It's actually so interesting that with modern technology that is available and which we're so privileged to be able to use, the water is now heated. So even the water that comes through the turbine is actually warm water. It's comforting water.
Yeah.
It's not cold water, which would precipitate more sensitivity from the tooth nerves that are already sensitive. So the 3-in-1 syringe that the dentist uses to dry the tooth and to rinse the tooth, that is warm air and warm water.
Yeah.
So I hope that what we have these days is significantly better than what we had before. Yeah. And the water that you rinse your mouth with, the water that washes the spittoon, is warmed.
Yeah, wonderful.
So it's just to create that sensation.
No, you're doing it right.
Comfort.
You're getting 10 out of 10 for that one, Doctor. High five.
Well, that is the manufacturers of the equipment these days.
So the brain comes into the dentist chair, the consciousness comes into the dentist, and so does the person's past. It's all there in that moment. Boom, there it is. And so we want to be able to don't do positive psychology, which is don't worry.
No.
That's toxic positivity.
Yes.
Every cloud has got a silver lining. I'm going, every cloud has got a lightning bolt in it. So don't tell me it's got a positive thing. So people use toxic positivity, and you can read it up on Google. You need to state reality, but you also need to state it with a sense of hope. So relax, you're in good hands. You need to tell the patient, I know what I'm doing. And here's what I'm going to do. We're going to pay attention to this and attention to that. And you don't need to give all the Latin names of what's happening. You just need to go, this is what's going to happen. We're going to pay attention to that, and then off we go. And then relax, stop halfway, do a little bit of a massage, get the person